Hi, I'm Dr. David Roberts from Manchester West Veterinary Hospital, and we're here to talk to you about something that's very exciting and new to our practice. It's called therapeutic laser. Everyone might think of laser as some kind of a science fiction project, but actually all laser is it's light beam. And light beams can do two different things. One is it can become a narrow beam and become what we call a cutting laser, or it can become a larger diameter, which is what we call a therapeutic laser. And that's what we've obtained in the past couple of weeks, and we've been treating a lot of dogs with it, and we'll show you how this works. We've been treating with my dog, Cruiser, which will show you how we do this, and you'll see it's a non-invasive, non-painful, easy treatment for the patients, and in most cases we have the owners, the pet's owner, hold on to the dog while our technicians actually perform the laser. Reasons that we use the laser are for many different things. This is what we call a class 4 laser. It generates the most wattage and the most tissue penetrating type of therapy that is available to us today. So we use it mostly for osteoarthritis. Osteoarthritis is basically arthritis. It's a joint problem. Everyone knows about dogs and hip dysplasia. This shows a dog with a normal hip over here. Nice clean joint. That's the thigh bone. That's the hip itself. And this simply shows a dog that has arthritic changes. Bone spurs, all kinds of, arthritic bone buildup. This is the application that we use for our dog Cruiser. But we can use it for any joint. We also know that with dogs, half of the dogs have hip dysplasia, and the other half of them with lower back pain or with lower limb problems, they have arthritis of the lower back. And that's actually just as important as hip dysplasia. So we are using this for those applications with arthritis. We're certainly using it for the knee. We're using it for all kinds of different applications. We've used it after our dental procedures, so after cleaning, not a simple cleaning, but after what might be more of an uncomfortable teeth cleaning for a patient, or an extraction, we're using it for that. We're even using it for ear problems. And that has been an exciting area because there's some dogs that have to go through a very expensive and a very painful surgery. Another use for the therapeutic laser is post-surgical or post-incisional. Our little patient here, Roscoe, has just had a neuter surgery. He had his castration surgery. So when we're done with the surgery, what we do is we'll go ahead and take his surgical drape off, and then what we'll do is we'll give him a laser treatment. Thank you. That's good enough. Laura, our technician here, will show us how she does that. So we'll go ahead and we laser the sides of the incision. We make sure that it's all, it will increase the healing process.
Okay. I'm starting.
Okay. We do this at Manchester West. We do this on all surgical patients, whether it's a spay or a neuter, a simple procedure, or if it's on a major procedure like a knee surgery or abdominal surgery. And we've just found that the healing process is so much quicker and so much less painful for the patients. So we're using it for every surgery that we perform here, and we do it at no charge at Manchester West. The way that the laser works is that it increases blood flow to whatever area that we use this probe on. So what we're doing is we're increasing capillaries, we're increasing the blood volume through the microvasculature, the capillaries. We're increasing oxygen flow, we're increasing glucose or sugar to those tissues, we're increasing getting the electrolytes like your sodium and potassium, and we're also allowing those capillaries to remove the bad stuff, which is lactic acid and carbon dioxide. So the laser actually works in many, many different ways through the same principle, but we can utilize it for different types of organs and different types of systems. We don't know. We may actually be using the laser for other problems that are internal organs, such as liver, kidneys. We're going to have to see how that progresses. It's relatively new in veterinary medicine. But the one thing we do know is that laser, it seems at this point, is the wave of the future. I'm Dr. David Roberts. Thanks for tuning in. Stay tuned for part 2. We're going to show you how we do the laser with Cruiser. Thank you.